Hi, my name is Constance Edwards. I'm the lead learning consultant at the Beer Institute at Children's Hospital in Washington, D.C. My presentation will focus on the technologies that impact healthcare. My learning objectives. At the end of this presentation, you'll be able to define an electronic health record and understand the impact it has on healthcare delivery. You will appreciate the advantages and disadvantages of the EHR, and you will be able to describe the different types of healthcare technology used in various healthcare settings. So what is an EHR? An EHR is a patient's electronic healthcare information that is shared among multiple facilities and agencies. It is a software system integrated with other resources and decision support, which I will talk about later in the presentation. We're going to watch a short video on health data collection. Think about your own healthcare providers and how they gather and use information concerning your healthcare. Are they producing positive outcomes in your healthcare?
Think about how many times you've used the healthcare system, how many times you've visited your family doctor, or a hospital ER, or had an x-ray, or filled a prescription. Have you ever wondered how all that information is maintained and shared between these points of care? Or if it's even shared at all? Now think about how this could affect the healthcare you receive. Look at it this way. You visit a local walk-in clinic where the physician requests a number of tests. Unfortunately, those test results may not always be shared with your family doctor. A month later, you experience similar complications, and your family doctor performs the exact same tests. Wouldn't it have been easier and more efficient if your doctor could have accessed those original results first? In your community, when you visit any point of care, information is collected regarding your health.
We have moved from the paper patient record to the computerized patient record, and with the help of computer software, we have moved to a more efficient and advanced type of technology, and this is the EHR. EHRs help reduce medical errors, improve patient safety, and support better outcomes. Some of the advantages of the EHR is that it is a computerized physician order entry type of system, meaning that the physician is the key person putting in orders, and with that, his orders are legible and the record is legible. He's able to have remote access to the electronic record. The electronic record, again, is integrated with other resources and data, and this integration comes with decision support. Some of the disadvantages of the electronic health record is the cost. These systems are very, very expensive. They also require training, and there is also going to be workflow changes for the clinician. Sometimes one system does not speak to another, so that interoperability between the systems can be lacking. And it has been said that the EHR depersonalized the patient-doctor relationship. And we have seen that this can be true depending on the provider. However, the EHR has significant advantages over paper records. Personal health records. If you have a box of your medical records, you have a personal health record. It's a collection of information about your own health. Some of the advantages of the personal health record is that it allows the patient or the individual to be active in their care by collecting, reviewing, and maintaining their health records. However, more and more individuals are moving away from that box of paper with a collection of your health records and have purchased an electronic personal health record. Some of the disadvantages of the personal health record is whether it's paper or electronic. What is the level of access you are going to give to providers or different providers? And how is this going to affect your care? And as we move from that paper box of health records to vendor applications, there are privacy concerns about how this data is maintained and secure. Who now owns your data? You or the vendor? And again, personal health record is very different from electronic health record. There is a big difference there. Health technologies in medical and dental offices. These system applications are somewhat different for the medical office and the dental office. And even though they are two different specialties, they both have to capture not only patient health information, but they need to capture billing, insurance, accounting. They need to capture things about your medication, and they both are able to e-prescribe or send your prescription electronically to your local pharmacy. In the dental office, they use additional software to capture images of your teeth and to make those dentures and implants. And these are called computer-aided design. Health technologies in inpatient facilities. So we're going to take a look at hospitals, and we're going to look at the pharmacy systems as well as radiology and radiology systems. Pharmacy systems improves patient safety by the use of barcode scanning, which has information about the medication and doses. The software can help verify that this is the right patient for the correct drug and doses. Within the application, there are decision supports to alert the provider and the pharmacist about medication reactions and interactions. There are also alerts and reminders. Radiology has come a long way. There have been many advancements in the technology of imaging, as well as the systems now support 3D imaging. So those CT scans, ultrasounds, MRIs, PET scans, they have improved as the technology has improved. As we continue with health technologies in hospitals, robotics and computer-aided design and computer-aided manufacturing has come a long way. Computer-assisted surgery, this is where robots are used in complicated surgery. And as you can see from the screenshot, that there is a surgeon, and what he's actually doing is controlling the arms of the robots using technology. In computer-aided design and computer-aided manufacturing, there has been so much advancements in the prosthetics, whether it's legs or hands or fingers. The advancements are unbelievable. Health technologies in rehabilitation hospitals. Rehabilitation medicine is restoring functionalities to the patients by the use of assisted technologies. These technologies include prosthetics, which we talked a little about, wheelchair and ambulatory devices, audiobooks, voice recognition. The main goal is to get that patient from the wheelchair to slowly walking and to eventually dancing at their daughter's wedding. Telemedicine. Telemedicine is the remote delivery of healthcare. The technology is being used everywhere. This technology links the provider and the patient remotely. the provider can monitor the patient by viewing images, have visual data. They could look at x-rays, they can look at skin lesions. This remote monitoring has come a long way, and with more advances, it will continue to grow in use. Health education. More and more we are seeing colleges, universities, certification programs utilizing online learning. There are med libraries and periodicals, medical journals online. It's quick access to knowledge, current research, and information. Simulation technology. This technology helps in the training of clinicians with practice simulations of procedures. This is used more and more in hospitals as well as schools. In summary, the electronic health record and health technologies in general has changed the way healthcare is delivered to people in inpatient and outpatient facilities. It will continue to change healthcare delivery and the management of patient care in the future. To recap what we have learned what is an electronic record, the advantages and disadvantages of an electronic record, and healthcare technologies that are available in inpatient and outpatient settings. Thank you. Again, my name is Connie Edwards, and I hope that you enjoyed this presentation.